Hello, good day. My name is Genalyn Romualdo from BSN 3D, and today I will be demonstrating surgical hand scrubbing, gowning, and gloving. Now let's proceed.
To start the demonstration, first step is to gather all the equipment needed. Prepare your surgical gown, sterile gloves, scrubbing package, warm running water, clean towel, face mask, face shield, disposable cap, and shoe cover. Prior to surgical hand washing, remove all jewelry because it can harbor microorganisms. Approach the surgical area with cap, mask, and face shield properly on. Next step, pre-wash hands with ABHR or soap and water to remove visible debris. But before doing the procedure, inspect your hands and forearms first. Skin of the hands and forearms should be intact with no burns, lesions, or cuts present. This is to prevent infection because open sores can harbor microorganisms. Fingernails should be clean and not extending beyond the fingertips. Artificial nails should not be worn because artificial nails, long nails, and extenders is also a good source to harbor microorganisms. You can now start your pre-scrub hand washing. Hand hygiene is recommended by the Association of Perioperative Registered Nurses or AORNs. Make sure that the hands are kept above the level of elbow at all times to prevent dripping of water into your scrub suit. This pre-scrub wash is performed to remove any excess dirt or contamination prior to proper surgical hand scrubbing. After pre-washing your hands, you can now proceed to hand scrubbing. Clean each of the nails using the nail pick under running water to remove all the dirt or potentially contaminating material. Once done, discard the pick by dropping it into the sink. We then now can proceed to actual hand scrubbing. First step, scrub the spaces underneath the fingernails of both hands using the bristle side of the brush. Next, scrub the palm and dorsal surface of your both hands. Followed by the dorsal surface, proceed to each of the fingers. Scrub each fingers using the 20-stroke method in a circular way. Start off to the thumb, into the interdigit space, and then to the next finger. Repeat the process until all of the fingers are scrubbed. Do the same procedure to the right hand. Once done, proceed into your forearms and perform the same procedure. Scrub the first half of your left forearm. 20 strokes in a circular way, and then the other half up to 2 inches above the elbow. Repeat the same procedure into your right forearm. Once finished, drop the brush. The hands and forearms are then rinsed thoroughly. Start by rinsing the hands down to the elbow using a one-way technique. This is to prevent microorganisms from returning into your now sterile hands. And then dry hands using the sterile towel. When you're done, discard the towel by dropping it into the floor. You can now proceed to surgical gowning and gloving. Lift the folded gown directly upward from the sterile table, and then step back from the table into an unobstructed area. Unfold the gown without touching the sterile exterior of the gown, and then slip both arms into the armhole simultaneously. Make sure that both of your hands are within the cuff. Ask the circulating nurse to assist you in donning. Once done, you can now proceed to your gloving using the closed glove technique. Grasp the folded cuff of the left glove with the right hand. Place the palm of glove against the palm of the left hand. The glove fingers point out the forearm, and then do the gloving completely. Do the same procedure into your right hand. Inspect the gloves for integrity after donning. If integrity is present, repeat the procedure from the start. This is to keep your sterility before surgery and also to avoid any contamination. Keep your hands above your waist and in front of you. Ensure you do not touch anything around you that's not sterile.